We will also go live on Facebook. So we may get a few people in the audience on Facebook. Unfortunately, I can't see their questions. I can only see the people who attend the Zoom class questions.
Okay.
But we'll keep on top of it for you.
Good. Did I hide my phone over there? I hope. But, let's get it out of here. I'm sure I'll get it. Where is the dog? Kind of call for home in a minute or something. Yeah. Homer's got a cone on now. Yeah, he got fixed yesterday and spent the night last night. So that's the big deal,
Yeah. What kind of dog is it?
It's a sad story. It was my wife and her daughter are animal lovers.
Mm-hmm.
They live 4 or 5 miles apart near the Bologna area. Stepdaughter was driving to our house, ran across a gaggle of puppies eating a dead cat on the road.
Oh, no.
So came down to our house to get a box to pick up the puppies and managed to give away 5 out of 6. And of course, I've got the 6th one, who is now, he has become the center of attention, as one would anticipate. And we've now done his DNA test. He has also been neutered and whatever the little claws are that don't count for anything.
Mm-hmm.
Declaw, he's declawed,
Mm-hmm.
neutered, and going to classes at PetSmart every week. And he has been through 3 different expensive dog beds that I'm aware of. And I don't know.
Got a chewer.
Yeah. There's no telling what's I'm not aware of. That he is the love of my life, though, I promise. So.
That's awesome. I live in El Paso on the
really?
county line road.
Yeah.
And so I used to live on a dead end road where a lot of pets would get dropped off. It's not very uncommon in the country, unfortunately.
Yeah. Yeah.
But I'm glad that this one has found a good home.
Wasn't El Paso kind of the center of where those dogs mauled that poor child?
Mm-hmm.
Remember that?
Mm-hmm.
Yeah.
Mm-hmm.
Kind of a sad deal.
Yeah.
We live near Bologna. We're halfway between Bologna and Conway.
Yeah.
On Saltillo Road. So we're around 8 miles, whatever.
Yep. Leah, I see that you've joined us. Would you like to give an introduction? Do you have that with you? Nope.
Well, I'm the program director, and I'm so glad that you're here joining us from Conway with LifeQuest staff. And this is our open and free to the public summer session. So it's a little smaller and more casual and laid back, but that's what kind of Zoom is. So we're going to have more people join us, but I'd like for you to tell them a little bit about your background, because I think you've changed midstream in your career, and tell us why you're doing what you do in Conway.
I am Dr. Mark Myers. I'm the physician here at the Arkansas Heart Hospital Wound Care and Hyperbaric Department. I have been in this facility for the last 4 years. Originally, I was doing wound care and hyperbaric medicine in Russellville. I previously was a general surgeon in Russellville from 1982 to about 1998 at Millard Henry Clinic in Russellville. In 1998, I had an out-of-facility cardiac arrest. Long and the short of that story, first helicopter ride to Little Rock and cardiac bypass surgery, and retrained in wound care and hyperbaric medicine, and did that in Russellville for from 98, 99 until 4 years ago, and relocated to the Heart Hospital here in Conway uh, for many reasons, but it's been a good experience. I went to 4 days rather than 5 days a week, but it's been an excellent opportunity to help people here in the Conway area. And so that's what we do. And 90% of our business is really wound care, 10% is hyperbaric oxygen therapy. Hyperbaric oxygen therapy, for those who don't know about it, is the delivery of 100% oxygen under increased atmospheric pressure. Basically, it dissolves oxygen into the plasma, the non-red cell part of the bloodstream. Bloodstream is made up like 48 or 45% of red cells, and the other half is plasma. When you expose somebody to an increased environmental pressure, it will dissolve the inspired oxygen in the plasma, the non-red cell part of the bloodstream, much like the opposite of opening a Coke or a beer, pardon the, but it will dissolve, that's dissolved carbon dioxide that goes out of solution, bubbles out, but we're bubbling in oxygen. As long as that individual is in an increased atmospheric environment, inspiring 100% oxygen, it will cause the tissue concentration of oxygen to increase to like 200 to 300 millimeters of mercury, where it's normally 20 to 30 millimeters of mercury. So it will help many people that have a non-healing chronic wound, that one of the reasons it will not heal is because it metabolically cannot draw the oxygen into the cell. So that is what we see many times in especially non-healing diabetics with foot wounds. They will develop a sore on their foot because they're neuropathic or have poor healing, and it just gets bigger and they don't feel it. And lo and behold, it can be a significant wound that can get infected and lead to the significant sequelae from an infected foot wound, the worst being amputation. So it's usually in older people, such as myself, that develop something like that. And one of the hardest things to do is if you have a older individual that you subject to an amputation, it's very difficult for them to retrain with a prosthesis. So many times, especially in the elderly people, we are subjugating them to life in a wheelchair, and just quality of life goes down from that point on. So if we can keep legs on these individuals for forever, how long, for their, it's a quality of life issue that helps people quite a bit. So that's where we get our warm fuzzies nowadays, is trying to help people with problematic wounds. Your turn.
Okay, my internet froze up there for a second.
Okay.
Sorry about that. So how did you get interested in the wound care area?
After I had my out of facility cardiac arrest, I was approached by another group of individuals that were in charge of the hyperbaric department at St. Mary's Hospital in Russellville. Originally, as a general surgeon, we really think we know everything as a general surgeon, and kind of discounted the hyperbaric oxygen therapy as a modicum to help people. Surgeons love to perform surgery and get people well quickly, doing appendectomies, gallbladders, whatever. The hyperbaric oxygen therapy is non-interventional, and by such, it is a time constraint. Usually people will undergo therapy with treatments for like 90 minutes once a day, 5 days a week. So it takes a while for them to notice a response from hyperbaric therapy. So it's, albeit it is not invasive, it is a time commitment from patients to go through with HBO therapy. So that's how I got into it, was a backup to doing general surgery. And plus I like to scuba dive, so they gotta go hand in hand with.
Oh, really?
Yeah.
I was gonna, you said that some of your patients are older and with diabetes is a
Yes.
common one. What
Very
are
common.
other types,
Other things that we,
types of reasons?
specifically from a hyperbaric oxygen standpoint, as everyone's aware nowadays, it seems like we treat insurance companies as much as we treat patients. Therefore, there are 13 diagnoses that are Medicare covered. They will reimburse for HBO, hyperbaric oxygen therapy, for non-healing diabetic foot wounds, chronic refractory osteomyelitis, decompression illness, are some of the things that we commonly see that will cause problems. At present, here at the Conway facility, we are treating 3 different patients that have osteoradionecrosis, which is a side effect of radiation therapy for a previous treatment for cancer. So it is a modicum to help treat osteoradionecrosis, which is bone that becomes pathologic fractures, or if they have to have some, usually it's of the jawbone, if people have had radiation therapy for ear, nose, and throat cancers, or possibly thyroid cancer, etc., and have radiation to the upper part of the jaw or mandible, will have a radiation injury to the jaw, subsequently leading to dental problems where they lose their teeth, and the oral surgeons need to do dental implants because the jawbone will not accept, it's just not, it's not a good bone till we do HBO therapy on it, and then they can go ahead and do their dental implants, and people who are basically edentulous before that are back to normal. So it's been found to be very helpful from that standpoint. We also have people that have other radiation injuries. Many times that people have radiation therapy to the pelvis, they will have radiation cystitis, which is irritation of the bladder that causes troubles, radiation proctitis, and radiation injury to the rectum or colon. And those are also made better by the use of HBO therapy. So those are primarily the ones that we help take care of.
So it sort of surprises me that this is all a part of Arkansas Heart Hospital. You know, we seem to think of Heart Hospital as being a single organ centered facility. So sort of help explain to me and maybe others that how you're fitting in and what all the scope of the Heart Hospital is.
Well, I think the Heart Hospital many years ago, when they initially started the wound care and hyperbaric medicine, it kind of like hand in glove, fits well together with the invasive cardiologist doing as much work for peripheral vascular disease, where they have hardening of the arteries of the lower extremities that will also develop non-healing wounds of the foot. Many of those people are also diabetics, but they will have peripheral vascular disease as well as diabetes. So we will see people that have a non-healing foot wound that also have a vascularly compromised lower extremity that is made much better by the interventional cardiologist performing their tricks with their catheters and balloons and atherectomies, and vice versa. After they have, quote, opened up a patient's blood vessel and they still have a wound that's not healing satisfactorily, the addition of HBO therapy many times is helpful to proceed with healing that wound. Our facility here in Conway is there are two different types of chambers when we talk about HBO therapy. There is a multi-place chamber where, as you would anticipate, several patients can be in the chamber at one time. So it's a big square facility that can be pressurized. The other type of chamber, if you will, is a monoplace chamber where a single individual is placed in the chamber that is then pressurized. We have two monoplace Perry chambers, brand name, largest ones they make, 48 inches diameter. People, basically it's an acrylic tube that they lay in. Most of them fall asleep watching television, really, but it's a treatment they undergo like 90 minutes once a day, 5 days a week. The facility in Little Rock has 3 of the same monoplace hyperbaric chambers. Perry is the brand name and the largest ones that are on the market at this point in time. So from a technical standpoint, we have good stuff, and it helps significantly with especially these peripheral vascular problems that many of the invasive cardiologists will see. Recently, here at this facility, as well as the one in Little Rock, with a public demand for off-label use of HBO therapy, which I was initially exposed to in Russellville, and anecdotal kind of information. I treated a autistic child whose mother was a nurse in Hot Springs. It made his autism better. There are physicians in especially the LSU area around New Orleans and Baton Rouge that are very strong advocates of the use of HBO therapy for neurologic abnormalities, post-stroke, etc. And it makes them better. That is not reimbursed by insurance companies at this point in time, but the people at the heart hospital are amenable to taking people at a case-by-case basis if indeed there is thoughts that HBO therapy might be beneficial to the patient. So it's not just it used to be a black and white, I'm sorry, but you can't receive HBO therapy because it is not covered or qualified for HBO. The world's changing on that standpoint. In Europe, there are 50 different diagnoses that are covered by HBO therapy, where it's only 13 in the United States. So you will see pop-up chambers around the country that show up to espouse HBO therapy. Most of the, quote, pop-up spots that do it for like an oxygen bar, et cetera, are not certified HBO chambers. To be an HBO chamber, you need to at least have the ability to increase the pressure to at least 2 atmospheres of pressure. Many of the ones that I've seen around in the United States are not really that. They're just blowing oxygen in a blow-up plastic chamber and billing or selling it to you as hyperbaric therapy, and that's not what it is. But people will do many things. But be that as it may, this institution is amenable to, on a case-by-case basis, looking at people if there is thoughts that it might be helpful, then just because your insurance doesn't cover it, they will work out a program to where we'll try to help the patient on an individual basis.
about we have a question about the dangers of wound infections possibly leading to sepsis. How frequently do you see that? And does your HBO type therapy work well with avoiding sepsis? Oh, I'm frozen.
Wounds can get infected, and a person with infection, which is very uncommon, which is like gas gangrene or Fournier's gangrene. Those are treated with the addition of HBO therapy that basically helps eradicate anaerobic, which is bacteria that live in a non-oxygen environment. So expose it to oxygen and it helps kill or eradicate those bacteria in addition to the use of anaerobic antibiotics. So yes, it helps, but no, it's not the only treatment that's needed. And frequently we will see wounds that are infected, and usually aggressive surgical debridement, increased arterial blood supply, and local wound care helps a lot. And that's what we do here.
What's a typical course of treatment? You mentioned it's an acrylic tube. How long does the procedure take? And
A hyperbaric treatment usually is a 90 minute at 2.0 ATA with 100% oxygen. That's the equivalent to about 55 feet of seawater at depth. So a patient will basically, we have a little gurney that rolls into the acrylic chamber. They lay on that or sit up in that, inspiring 100% oxygen that's being delivered under increased atmospheric pressure. They will usually feel some pressure on the middle ear, much like going up in a plane or up in the mountains in a car. So they have to equilibrate or pop their ears so we don't have any middle ear called barotrauma. Most people are able to do that by either yawning or holding their nose and blowing. Sometimes people who have had previous ear infections have enough scarring of the tympanic membrane that we will have to have a PE tube placed, much like little kiddos do, for them to tolerate the HBO treatment. But that happens maybe 5 to 7% of the time. I have, in my years, had 2 people that had claustrophobic problems because they are in a enclosed environment for 90 minutes. The acrylic tube helps a lot, and it's a lot easier than an MRI. But there are, like I said, I've had 2 people since 1998 that just were unable to tolerate the HBO chamber for claustrophobia. Sometimes we have to give them a little mild sedative, a little Xanax or whatnot to undergo the treatment, but that's even much more an exception than it is the rule. And most people honestly just fall asleep because there's a whirring noise from the oxygen going into the chamber. And you can pretty make book that within 5 minutes of being in the chamber, you can turn over and look at them and they're all asleep. So it's kind of a cool deal because there's not much you have to do to them except make sure they're still watching TV or etc. for the 90 minutes. And that's 5 days a week, many times several weeks, 2 to 4 weeks is the usual therapeutic modality that's needed.
I think we might have lost Leah's connection there for a little bit. I have a question for you. What do you want patients to know that they could do to prevent themselves from coming to see you? Are there better ways people could treat their bodies and their wounds, or diet or anything?
The primary thing is since we mainly see diabetics develop neuropathy or poor feeling of their feet. How many times I have seen a diabetic come in that's had a nail in his foot or a screw in his foot for a week to 2 weeks and didn't know it is astounding. So foot care in a diabetic is real important. Just visualizing your feet, and sometimes that's hard to do, but where there's a will, there's a way. If you need a mirror to look at the bottom of your feet, but they need to be visualized daily, and good foot care is very important in a neuropathic diabetic foot. The other things that can help many of the people that have significant peripheral vascular disease or venous insufficiency will have significant swelling of their lower extremities and will develop a sore. It's very prudent if you will seek medical care for that problem of venous insufficiency at an early stage. The longer a wound is open, God put skin around us for a reason. That's to keep the internal milieu in and the external milieu out. So we want the bugs on the outside and not on the inside of the skin. So if you get a sore, that's just an egress for bad things to happen. So we try to keep a sore closed or close a wound if at all possible. And if you have a wound that will not heal after, say, 3 to 4 weeks, it's probably time to seek medical care and find out the reasons that wound is not healing. Many times it's as easy as decrease in swelling. Many times it is a chronically infected wound that would lend itself well to aggressive debridement or removing the non-viable tissue. Sometimes it's from a vascular standpoint that more oxygen is needed in the blood. Hence, doing non-invasive tests like done at the Peripheral Vascular Institute at the Heart Hospital with different ultrasound therapies to find out if the blood pressures are normal in the feet and legs will be indicative of need for further investigation and possible peripheral intervention. If people have a problem or just wanted to have a question, we're more than open to have them call our department. I mean, we're in the COVID world, we have decreased the number of personnel at our department. If you call our number, you get one of 3 people. It's either me, Julie, or Brittany. Only if we were all 3 tied up would you get a voicemail. I detest the robocall world of physicians. It's just not my forte. When I retire, they can do what they want to do, but right now, we are the 3 people that answer the phone, and hopefully we can help you with any question you may have. So we're here if you any question, and there's no question is below us. I mean, it's just crazy.
I'm right there with you. I have a question from someone in the chat. She's used polysporine or neosporin for many years. She says she's a fast healer. She usually uses those and finds good results. Are you a fan of antibacterial ointments or Band-Aids, or would you rather people leave them natural and let them?
No. Yes, I'm a fan of it. No, there's no reason not to use it. Frequently, if it is a garden variety, minimally traumatic wound, I know Julie's tired of hearing me say to people, you need soap and water and a Band-Aid and put a little Neosporin on it. If that doesn't help, come back. We'll see you in a couple of weeks. But cleaning the wound is the sine qua non. Without that, it just probably won't get healed. It just, if you were to take a culture of a traumatic wound, it would kind of scare you, all the different bugs that grow in it. So mechanical debridement, or washing it with soap and water, is a wonderful tool. So that, and then a little triple antibiotic ointment doesn't hurt a thing. I mean, you'll hear all sorts of stuff in the wound care environment or personnel that don't put anything on the wound that will not promote healing. Well, everything's relative, and a little bit of TAO, triple antibiotic ointment, usually does not hurt something. So there you go, my 2 cents on TAO.
What are some risk signs for infections? If you have a wound that lasts longer than a week, or if you have something like folliculitis and it doesn't seem to be clearing up, how can
2
you tell
weeks,
them?
open wound, 2 weeks, erythema, pus, tenderness, streaks going up the extremity. That's it. That's infection, you know. And so where it gets bad is if it gets septic, if it gets in the bloodstream and spreads and start running fever and general malaise, then that's an emergency kind of situation. So redness and tenderness. Okay.
You mentioned the hyperbaric chamber being used for other treatments in Europe. I'm just curious about what those are and if you see any of those coming to America anytime soon.
Neurologic abnormalities, strokes primarily are what we're dealing with. If an acute stroke, it's really cool. We will see people that have had not a reaction or a complication from a cardiac intervention. Sometimes they will have either a little plaque pops off and goes to the head, to the brain, or an air embolus. If we put those people in the chamber immediately after it's diagnosed, we virtually reverse anything like that. So I've had very good, this is anecdotal, but I've had very good results treating people that have had immediate HBO therapy from a complication of a cardiac catheterization to an extent. The sooner somebody can get in the chamber after they've had an event after a cardiac catheterization or surgery, et cetera, then usually the decreased zone of anoxia to the brain. So we can help that. Strokes are the same way. The quicker it can be treated with HBO therapy, the decreased zone of anoxia to the brain tissue and the lack of blood supply or lack of oxygen to the brain, anoxia.
You may not know the answer to this, but so you practice in Conway. Do you know how many other of these chambers are in Little Rock or the greater Little Rock area or across the state? Is this something hospitals commonly have?
Frequently, not commonly. Heart Hospital has 3 in Little Rock. St. Vincent has 2 to 4, I think, at the big facility. Baptist has 2 to 3. Spring Hill, don't know about the big Baptist, don't think so. They used to have a multi-place chamber at St. Vincent's, doesn't exist anymore. Used to have 2 chambers in Russellville, those were mine. They're not there, we're in Conway now. Fort Smith has them, Northwest Arkansas has them. Other than that, I'm not familiar with South Arkansas at this point in time. So that's the best I can tell you. With
So anybody in Hot Springs or Batesville, those kind of areas, would have to come to Central Arkansas to be treated for these sort of things.
They need to check with their regular doc. Northwest Arkansas, Springfield has them, Tulsa has them. But I get a lot of patients that were leftover patients, if you will, of mine from the Russellville area, Clarksville area. So you know, up the interstate to that extent, as well as around this area, Perryville, north of here, Heber Springs, Clinton,
Mhm.
you know, south of here, usually Little Rock catches the majority of the people from the south.
Someone else asked a question. Given it's summertime in Arkansas, do you have any words for tick or chigger bites getting infected? How to prevent that when you're scratching in your sleep and that kind of thing?
Well, chigger bites, you let me know when you figure out how to help chigger bites, okay?
Yeah, that's kind of how I feel about it.
Tick bites, you just take the tick off, you know, and you know how many different old wives' tales there are about getting ticks off, but try to get the head off. If it stays in there, it gets infected, causes a small boil. That has to be treated if it doesn't lance on its own. I was hoping you were going to ask me about brown recluse spider bites because we help
Well,
with that.
spider bites is part of it. Yeah,
Yeah.
I've got that one.
A brown recluse spider bite, the isosceles spiders venom causes anoxia or lack of oxygen to the tissue after its bite, and it'll cause a big black necrotic area. We can treat those in the HBO chamber, and it decreases the zone of necrosis. When I was doing general surgery, the majority of people bit by a brown recluse spider, put on a pair of pants after it's been hanging in the closet forever. So you would imagine where they're bit most of the time. It's usually on a area of significant adipose tissue that is not well vascularized. So that's the obvious spot for it to get worse. I used to have to excise many areas of large clumps of dead fat for a big old brown recluse spider bite. With the addition of HBO therapy, knock on wood, I haven't had to excise large areas of necrotic fat as often, or I haven't had to since I've used the chamber for brown recluse spider bites.
That's awesome. I never would have thought to ask a doctor after getting a bite like that. And I imagine for someone who's diabetic and doesn't feel it, that probably would progress quite a bit before they went to their doctor.
Yeah, most people, in fact, a brown recluse spider, when it bites, it doesn't hurt like a, black widow spider does. So the sooner they can seek medical treatment and get an HBO treatment, the better off they are. High percentage of the time, it's 2 to 3 days before they see a physician. It's another 2 to 3 days before that physician recognizes what it is. So by the time they get to where these chambers are, they're a week out, and it's muddies the water, so to speak. So, but anyway, those are some of the things that we help take care of. We've got other people that have significantly poorly healing wounds that we could show you a picture of, that if you wanted to look at it. Kind of an interesting individual that had a real bad wound on his heel from, once again, neuropathic foot, had poor feeling in his feet, thought he needed to use his wife's healing pads for his cold feet, left it on too long, burned his heels, burned it down to the bone. So it was super bad. And then he was a friend of mine from the Dardanelle area, but his, you can kind of see what his heel looked like when we initially started, and then now it's just totally well. But he underwent HBO therapy for that, and that still has both feet and is a happy camper. So we see that quite frequently.
I'm glad you were able to save his foot. And that's not as bad as some wounds I've seen, so I appreciate that. Should have said a disclaimer real quick. If you're sick at your stomach at these kind of stuff, turn around.
Yeah.
Do you have any other photos you'd like to share with us?
Yeah. Probably not after lunch. Let's do it before lunch.
Okay. since this is summer, also along those same lines, do you ever, I guess sunburns are more, not as deep as those kind of things. And so that wouldn't necessarily be a good fit for the chamber.
Not really. I mean, usually if it's a partial thickness burn, like a sunburn, which is second degree, yeah, it is usually not treated in a wound care department. Now, if it blisters up and then doesn't heal from being blistered up, and we see lots of those people too that will have problems. In fact, we've once again see diabetics, neuropathic feet walk on asphalt, burns the whole bottom of their feet all the way down to the bone, and end up doing HBO therapy. So it's all back to that. If you can't feel your feet, at least look at them every day. And if you can't see them, get a spouse, partner, somebody on Zoom to look at them.
This is going to kind of sound weird, but we started this hour talking about your pet, and that makes me think about pets' paws walking on concrete. Do they treat animals with this chamber at all in vets' offices?
There are hyperbaric chambers for animals. One of my pets used to be racehorses, and they do treat racehorses with hyperbaric oxygen therapy because of the pulmonary hemorrhage that they have. So yes, it is available, usually in very small circles like expensive racehorses, etc. Or if somebody has a pet that has a lot of money, then they might treat them. But not many vets have a HBO chamber.
I understand that money would be a limitation, and insurance is normally accepted for this and that kind of thing. And so I wouldn't expect people with their house pet that they got for free would take their dog to this kind of thing. But it's interesting to learn other ways it can be used with other animals and that kind of thing. I wouldn't necessarily know that. Is there anything else that you'd like to talk to us about?
That's about it. I would give you our phone number if I knew it off the top of my head, but you're welcome to call if you want to. It's
go ahead.
501-205-7910 for our facility here in Conway. But
I'm wondering if anybody here has had experience with HBO therapy or know someone who has. Has anyone had that experience? And if so, you can unmute yourself. Or if there are a question from the group on another topic. Ralph, I know you have a question. Sandra. Okay, if there's not any other questions, I was curious about your scuba diving. How long have you been scuba diving?
Since 1998. Done 500 or 600 dives, primarily in the South Pacific.
Wow.
Malaysia, Indonesia. Once you get in the real clear water around the equator, it's hard to go back to the lake. So
was that good for your heart?
Yeah, it's great for your heart. Yeah.
Good for your recovery. Yeah.
No, it's wonderful. Yeah. It's in fact, it's great continuing medical education for hyperbaric oxygen therapy.
I bet.
We're always on a boat and know who gets the bends and who doesn't get the bends. So, good.
That's fascinating. That's a whole other class right there about your scuba diving. Yes. Do you ever take an underwater camera?
Oh yes.
Yeah.
Yes, I've spent as much money on underwater cameras as I spent on racehorses. And
oh my goodness.
I found out that there are people much better than I at taking underwater pictures. So I've turned into an observer rather than a picture taker person. And when you see the size of the cameras and the strobes that these guys are doing, and how they're kind of hogs about what they look at, it's better just to take in the whole environment for me, and then I'll buy their pictures and look at them. So
Well, that
It's a-
sounds fascinating.
Yeah, it was great before the COVID hit. Right now, it's just kind of international travel is
Right.
just not there. So it's going to be a mess.
Well,
So-
that's why we're expecting a full house this fall at LifeQuest for online learning, because everybody's going to be sitting on the couch and wanting something to do and use their minds and stretch their intellectual skills. So we're expecting all these folks here today to sign up for LifeQuest classes in the fall. We really appreciate you in the hour that you've shared with us today. It's fascinating. It's a part of medicine that not very many people know about. And you're fascinating as well. Your whole background is so interesting. So we really appreciate you. Arkansas Heart Hospital is a sponsor of LifeQuest, and so the partnerships that we have with the physicians over the years have been really important to us.
Thank you very much.
Questions? Yes. Thank you so much. If there's any more questions, we'll let you get back to work and save lives. Thank you. Thanks.
Thank you very
Bye-bye.
much.
Yes.
Thank you. Thank you, girls. You all did a great job. Thank you.
Cool.
My internet, my husband's doing therapy in his downstairs office, and it cut him out at the same time it cut me out. And the hazards of
The
Wi-Fi.
COVID life. The COVID
I know.
life.
That's right.
I know.
Great, isn't it? Yeah.
Not
Oh.
sometimes.
Well, call us if you need us. We're up
Okay.
here
Thank
All
you.
right. Thank you
in
so
the
much.
hinterland.
Great.